Welcome in, everybody. Just gonna let everybody trickle in. All right, it's 12:30, so we're gonna get started. We have a lot to cover today. So today we're reviewing HHSC East tips and tricks. So our training will be focused on these facilities only from HHSC East. On our agenda today, first and foremost, we're going to give a big welcome to our newest team member, Kimberly, and just kind of a little quick intro to those of you who may not know who we are. Then we're going to get into the overview of the facilities and the tips, and we will finish it off with some questions. It should actually be a little bit longer. We're going to spend a little bit more time doing the overview, but that's not important. The facilities that we're going to highlight today are those with HHSC East. I don't know where this presentation went, Clarissa. Oh, thank you. So we'll be showing records from Honoka, Hilo, Benioff Medical Center, Ka'u, and Hilo Benioff Medical Center Primary Care. The purpose of this, we're not actually going to be in the CHR, but we are going to be pulling snippets from it so that we can record this and show everybody and make sure that it's easy to follow along, and so that you're getting the information that you need so that when you do go into CHR, you can find those records as we're showing you. So if you don't know me, my name is Jackie. I'm the client relations specialist with the provider services team. I am a speech therapist by trade. I've worked with HHIE for almost a year. I run our registration portal. If you're adding and removing users, I'm the person that's going to do that. I also help out with our help desk. If you have any issues with getting into CHR or needing a password reset, I am also behind the scenes. In addition to me doing that work, we have our newest team member, Kim, who I'm going to take a second to let introduce herself right now. So Kim, take it away.
Hi, everyone. I'm Kimberly Taylor. I'm thrilled to be the newest member of the provider services team here at HHIE. I have a background in labor and delivery as a nurse and case management, and I hope to use that experience to get the most out of the services for you guys, to provide a clinical background to everything that we're doing here on the back end. So it's nice to meet you. You'll probably see my name pop up in some emails through the help desk going forward if you haven't already.
Awesome. Thank you, Kim, for introducing yourself. So really great to have extra help on the team. In addition to kind of doing the help desk, it's really enabled me to start taking over some CHR trainings. They are usually run by our next introduction in line here, Miss Clarissa, but you might be seeing me on those as well. So without further ado, I'm going to introduce the yin to my yang and our director, Clarissa.
Hi, everybody. I'm sure my face probably looks a little familiar. I am the lead CHR trainer for HHIE. I also am the trainer for our Notify tool. I am so excited. As you can see, we are all clinical staff here, which is awesome. I think that really provides a unique perspective for using the tools when you have someone who understands a clinical workflow presenting that service to you. And I'm really excited today to really dive into the HHSC East connection. So for that type of demonstration, like Jackie mentioned, I'm going to have some screenshots, and we're going to talk really quickly about where do I start? If I'm looking for data from HHSC East, where do I go? And so the first place we're going to go is going to go to the results tab. If you've done a training with me, you know that I don't like the provider service, the patient summary tab. That tab is just a kind of like a landing page. So we're going to first use that left-hand side, and we're going to navigate to the results tab. From there, we're going to first start off by looking at those trans documents. So when you come into the results tab, you do have that type that is opened up with all of the different options that you can search, and it defaults to all of them being selected. So the variety of different data here would be labs, radiology, TRANS, which are transcription reports. That's what that stands for. And those are medical record reports. So think ER notes, discharge summaries, consult notes, could even be like PT, OT, and speech therapy notes. It's going to be all of that encompassed in that TRANS folder. And then we also have two others that are not present today in my screenshot, but that's going to be PATH, which is pathology results, and then cardio, which is any type of EKG and echo. Now, HHSC East has its own unique way of sharing echocardiogram and EKG reports, and we're going to discuss that today, but that may be another search option you see. So let's kind of deep dive into what we would do here. So first off the bat, we would deselect all, and we would only select that TRANS option as our search. And then we're going to use our search text. And the reason this is an important way to kind of search it is because there's so much data coming in, right? So we have a lot of data coming in from HHSC East. And so by using our search text, it really helps us get to what we need quickly. So we're going to kind of follow along as if our patient's in the hospital. So a patient presents to the emergency room for care at one of the HHSC East clinics, or sorry, the hospitals. And you're going to be able to see that emergency room visit. So my favorite thing to search is going to be ED provider. This brings up all those ED provider notes, whether it's the full discussion of what's going on with the patient, as well as the decision to admit or discharge. And you can see by searching in that search text field, ED provider, it does kind of do like a Control F, a search and find. And instead of all of those different notes, because with HHSC East, they're sharing ED triage notes, we're getting some nursing notes in there, some updated vital signs periodically throughout the exam. All of those create their own encounter or their own note. And so ED provider notes is a good way to look for that full clinical picture. Once you find an ED report that you do want to open, you easily click into that report, and it's a free text display, meaning that there is no hyperlink. For those of you that are familiar with our system, especially with Queens and Kona, you know that their transcription reports are in that little blue hyperlink. For HHSC East, it's actually going to open up automatically. And it's going to look similar to this. You're going to be able to see that note right away. It starts off with an HPI, a chief complaint, and then it goes into that HPI and chief complaint. Now, one of the things that I've really found helpful with HHSC East is when you go to export these. So if you were to click that print option, I'm going to highlight this a few times throughout, but it really shows a really great, almost like a mini face sheet inside of that note. So when you hit print, it transforms it into a PDF version, and it gives you some really great demographic information at the top. And one of my favorites is right over here, this ICD-10 code display demonstrating what this visit was related to, and it's going to pull it at the very top. So I do love that. I hope you guys take a look at it. Like I said, I'm going to be pulling it out a couple times in here. So let's kind of talk about some of the key features that I found. So one of the things to highlight right off the bat was when we went live with our connection with HHSC East, when they went with the Epic connection, we noticed that some of our bullet points and special characters were not displaying correctly in the community health record. So we have these question marks that were appearing. They were happening a lot with the problems list and medication lists. And people were messaging me and saying, does that mean like they're not sure, or what was that? And it's truly just a display issue. It was not recognizing the bullets or the special like dashes or characters. And so it was displaying it as a question mark. We did get it over to our team, and they were able to fix it. So any older notes prior to about the beginning to middle of May, you will see these question marks, but from the beginning of May to now and continuing on, those special characters are fixed, and you will see them in a bullet point format. So if you've done a training with me, you know my favorite thing to highlight, one of my key things is Control F. I love that feature. When you open up a note, that can be a lot of clinical data to review, right? There's tons of, like, you're scrolling through a document trying to find what's important to you. And so one of the key things that I found to be helpful is Control F and searching for the areas where clinical data may be that provides that importance. And the two over here on the right-hand side are going to be those two things. So inside those ED provider notes, I love Control F and searching for ED course and MDM. This does, in that screenshot there, shows what that exactly looks like. It does go through like what care the patient received while they were in the ER. It kind of talks through the medical decision making for the diagnosis and the rationale for what management was provided. And then it's going to indicate what follow-up this patient may need, whether they need to follow up with their PCP in a few days or a week or whatever that may be. And then the other one is looking for those ancillary studies. So this is where any labs or diagnostic reporting like x-rays or imaging ultrasounds, those are going to live there as well. So both of those areas, if you're looking at an ED provider note and you are opening it up to view it, hit that Control F, type in some of these key headers, and that will get you to the bulk majority of what you need to help with the coordination after an ER event. So what happens if the patient wasn't to be discharged? What if they saw the ED and the decision was made to admit the patient, right? So a decision to admit. What we're going to do is we're going to search here. We're still going to select that box for trans. And instead of ED provider note, we're now going to type in H and P. And what this is it's the history and physical for that admission. It's going to look just like this. My little box keeps turning both ways. So it's going to be that history and physical. Histories and physicals are really great because it discusses very detailed of what's going on with the patient, the clinical picture, and the plan of care. And then again, can't highlight this enough. I absolutely love it that once you open a report and you hit print, it is going to display with those ICD-10 codes at the very top. I do love that. So let's kind of dive into this one. So again, my key search phrase here is going to be assessment and plan. What I love about these is it's not just like a bulk, like, okay, the patient's going to be admitted, we're going to do this, we're going to do that. It's really broken down into all of the individual diagnosis. And I wish I could show you, but it's really hard to redact PHI in a note like that. But if you type in that Control F and assessment and plan in those H&Ps, it's going to go over all of the admitting diagnosis, like what each admitting diagnosis is, as well as any comorbidities, things that may need to be addressed while that patient's in the hospital, right? So if they're admitted for a cardiac issue, but they also have type 2 diabetes as an underlying condition, that is still going to be addressed in that assessment and plan because the patient may need to continue home meds or they may need to continue insulin. It's going to go over that entire plan of care for what's going to happen. And I absolutely love that stage. The other one is going to be specific for my utilization people on the call today. A couple of the key things that I found inside these H&P documents is going to be this 2 midnight certification. And I also love the recertification statement. So it's basically saying that this patient needs hospitalization to avoid an adverse event. And that what the anticipation, they say that this patient is specifically looking at least a 2 midnight stay. So I do love both of those. I love absolutely looking at those documents, and those two things for utilization is definitely something I would take a look at. So your patient's being seen along the way, you're still going to have access to all of those clinical documents, including those consultation notes if the patient was admitted and maybe there's a consult in for cardiology or GI or PT and OT or speech. All of that's going to be in there along the way of the stay. But once the patient's discharged, right, now it's time to go home. What do I look at if I'm looking for that care coordination? So again, we're going to go trans. Oh my goodness, this is driving me nuts. We're going to go trans and select just that trans. And then we're going to come over here and we're going to search text and type in discharge. And what that does is it narrows your focus to only viewing discharge information. We do see that with the new connection, we get these discharge summaries, but sometimes they are labeled as discharge SU. There is absolutely no difference between what's inside the notes. They're just kind of presented to us the way that it's coming through the data. They're just labeled a little differently, but they are the same type of notes. Now, at the very beginning of this, Jackie mentioned the different facilities, and that is how we see over here. So inside the parentheses is where we see the different facilities. I believe on a couple screenshots before, there was one for KAU as well. So it's really helpful because when we went live with the connection with Epic, everything was labeled as Hilo Medical Center Epic. So any new data coming in from November 2025 to now is labeled as Hilo Medical Center Epic. The way to distinguish which one of the facilities within HHSC East the patient has been to is going to be that inside the parentheses, which is what was on that first slide. So this one, HHLTC, that's Honoka. We do have Hilo Benioff Medical Center. KAU is KAU. And then one of the other ones, because we are getting outpatient notes for like office visit type notes, those are going to be labeled. Sometimes I see them HBMC depending on where the provider is giving the care, but I also see it as EH1190, and that is the primary care clinic. So keep that in mind when you're looking at these. That inside that parentheses is going to give you a little bit more detail about which facility within the HHSC organization the patient's actually been to. One of the other things I like to pinpoint here, and this is kind of a newer thing that I've just kind of recently been highlighting during my trainings, is this filter up here at the top. So the data in our system, especially in the results tab, it goes back all the way to the beginning of when the community health record was started. Just yesterday, I was doing a training, and the oldest data that was in this results tab was 2010. And so sometimes that can be overwhelming, right? I think the most pages I've seen is probably like 30 some pages worth of clinical data. And so what this filter here at the top that allows you to do is to narrow that to whatever criteria you want it to be. The filters include last 30 days, last 3 months, last 6 months, last year, and all records. All records is the default, which pulls in all of that clinical data. But if you ever want to just kind of narrow it a little bit further, especially if you're looking for a discharge that happened recently, use that up at the top to narrow it down a little bit further. It will definitely help you out. So we find our discharge summary that we want to view, we click into it. And again, just like with the others, it does open up with the detailed information. It starts off with the discharge diagnosis, and then it goes into hospital course. As always, I love it to highlight it. When you print that discharge summary, you do get that mini face sheet with those ICD-10 codes at the top. And then here are my favorite control Fs throughout the discharge document. The first is going to be that hospital course. It's right here at the top, right after that discharge diagnosis. So I do love that it's really close to the top. But this is going to be that problem-focused story. What happened to the patient during this day? And it is going to be diagnosis by diagnosis, which I love. And it's going to tell you what was done, how the patient responded, as well as what follow-up care, like what's going on. For this diagnosis, the patient needs to continue speech therapy. For this diagnosis, the patient needs to see cardiology. It's going to go diagnosis by diagnosis to give you that description of what happened and what the follow-up needs are. One of my other favorite searches, outpatient follow-up and future appointments. This is a really great area for identifying appointments that they have already been made for the patient while they were in the hospital. So it will tell you the facility, the appointment date and time. So that way you know, hey, this is already set up for the appointment, as well as what needs to be made. So what appointments do they need that weren't already made? And then one of my favorites, this one's really cool is disposition. I like this one because oftentimes, especially in significant life events, patients don't just automatically get to go home, right? So disposition is going to tell me where that patient is going. I gave you some help things here like home, SNF, hospice. Also, another one is a transfer to a higher level of care. If what the patient has received is not going to be the end stage, maybe that transfer is necessary. So it's really good to see those. So I love these control Fs when I'm looking through an inpatient discharge summary. A couple of the other notes that I really want to highlight here, because it is so many notes coming in from HHSC East. The first one is going to be this care area assessment, as well as the care and service plan. Both of these are pretty specific to discharge planning, as well as just overall care planning. It is looking at the overall patient care needs, not just medical. I love the weekly discharge planning one, the care and service plan. It really goes over medical diagnosis and care planning for discharge, as well as those SDOH type measures. So if the patient is houseless, And that's going to play into what follow-up care they may need or getting them established with the right resources. Those are all captured in those clinical notes labeled with care and service plan and care area assessment, and I absolutely love them. Just a couple helpful hints too. So PT, OT, and speech, these are labeled as progress notes. I think in the past, maybe they were labeled as consults, but for our HHSC connection, they're labeled as progress notes. And then nutrition is labeled as a consult. So be looking for those if you're looking for any clinical documentation related to that. As I mentioned before, there are a lot of nursing notes and then also these long-term monitoring daily notes. These are, they can be, there's so many, right? They're being updated. It's pushing to the system. I think one nursing note I read was like patient disconnected from leads to go to the bathroom. And then the next one was patient reconnected to leads after bathroom. So in each one of those were their own little note. It could be a sentence, it could be a paragraph, it could be something as simple as patient requesting pain medication. So take a look at those for sure if they apply to what you need. But to me, it starts to get a little bit overwhelming with all of the little snapshots. The other one is the long-term provider or LTC provider review. This one is great when looking at the medical picture. Reviews ongoing care needs. So it looks at, hey, this is the medical necessity for the patient remaining in that long-term care environment. And I love that our utilization team loves looking at those type of notes because it really goes into why the patient needs to remain in SNF or rehab or long-term care treatment areas. So now that we've kind of highlighted all of the trans documents, we're going to talk specifically about radiology. So coming in, if we were to deselect all and only select radiology, this is where we're going to see radiology studies from those HHSC facilities. That includes ultrasound, X-ray, CT, MRIs, whatever may be available at the facilities, it's going to be there. Now, for some of our other connections, like Queens, we do have the specific cardio, right? You've probably seen that little tab. It comes over here, it's usually on the end, and it's another little checkbox for cardio. HHSC East shares their cardiology studies in radiology format. So they're in that RAD area. So if you're ever looking for those, please look there. And again, it's not a PAC system. You cannot view imaging right now in our current platform, but it will give you detailed reports of what's going on or what that imaging found. And we are seeing that better naming convention. For those of you who have been with us for a while, you know those old radiologies from HHSC East, they were labeled just as radiology imaging, I believe. And so they were so hard, you had to go one by one to figure out which one it was. But now it's fixed, so happy for that. Another thing I'm happy to report is the improvement of those echocardiogram reports. So prior to that Epic go live, the radiology reports would open with this little naming. It would say echocardiogram results reports available in the reports panel, but they wouldn't actually attach the document. And so we were not getting them. This is what you would see if you were a user opening a cardiology or an echocardiogram report. So very difficult. After the implementation, this was awesome. This was actually brought to me by a user. We see that we actually have that hyperlink now. So if you click into that echo, you have the link, you click it, it opens up. It's beautifully formatted. Please take a look at those if you need them. Lastly is laboratory studies. And this is the only data gap we currently have with HHSC East. We are not getting any labs from them, either directly with the facility or with the diagnostic or clinical lab connection. This is kind of a work in progress. Our team is on the backside of things, really trying to work to fill that data gap. And I'm hoping here soon we have that kind of filled in and have a path forward to improve it. So if you were to go to just selecting labs, you're probably going to miss out on all of that clinical lab data and diagnostic lab data because we don't have that connection. So for now, if you are trying to view labs that were done at an HHSC facility, look inside those transcription reports. And this is where that ancillary studies comes into play, because ancillary studies will house some of those labs that may have been done during that visit, whether it's an ER visit whether it's an office outpatient visit, as long as the provider has documented it inside that note, that what those labs were. It is hit or miss because sometimes they do, sometimes they don't. You may see some of those labs inside those transcription reports. So that is a workaround for now. I want to turn it over and see if there's any questions.
While everybody is, just kind of gathering around, nearing the end here, I did want to highlight that for HHSC, we spent a lot of time in the results tab. And for other facilities such as, HPH or VA, they're going to be located in the documents tab. So whenever you have questions on where you're going to find that data, we always say reference this data flow chart. You can see the HHSC East up there. There's no star next to that, next to Hawaii. So it's blank. That means that's in the results tab. That's why we lived it in there throughout today. But for some people where there's the little asterisk next to them, such as HPH, the information's in the documents tab. There is a question. Will there be future implementation of being able to view other EHHC clinic visit notes for our veterans besides primary care?
I think that there's definitely opportunity to more detail expand the data feeds. I believe from what I've seen, it's been pretty widespread. So if there's any particular providers throughout that HHSC environment that are missing, please let me know. If they migrated to Epic, I believe we're getting them. But if some of those outlying clinics did not migrate when the migration happened, it may potentially be a data gap. So please, I'm going to show, let me get that back up here. On the next slide, we do have all of our contact information. Please reach out to me if you are missing some particular provider notes from the outpatient side. And I'm happy to look into it to see if we can kind of create a connection with that particular clinic.
Yeah, that's actually kind of a nice segue because what I'm going to do is I'm going to put in the chat also is a survey, and this will only take a minute or two. If you feel like these trainings are beneficial, or if you have a specific facility that you want us to review, please go ahead and fill that out and let us know. The purpose of these forums is to make something that is helpful for you all. And so if you give us feedback, we are happy to cater these trainings towards that. So with that being said, we have 3 more minutes-ish. If there's any more questions, we'll try to squeeze them in.
I think someone's unmuted. Are they trying to ask a question?
Not sure. I can't really hear. Thank you all.
Yeah, thank you guys so much for your time. I do want to kind of end today with kind of highlighting with our contact information. If you find that this is really helpful, as I said, each month we're going to highlight a different facility. Kind of getting the feedback from you on which facilities you want to see would definitely help. I chose HHSC East this time because, wow, they are sharing quite a lot of data. And it's super difficult to figure out which ones are going to be helpful to you. I do want to say, if you want to schedule a more in-depth training, please reach out to us. I am the lead trainer, but as Jackie mentioned, I'm so happy to have some help on that side. So if you want to reach out to me, reach out to Jackie to schedule a one-on-one CHR training, whether it's individual or with your team. We would love to get those scheduled, and hopefully here soon we'll get Kim on board too. She'll be another person who can conduct the trainings. So really looking forward to kind of making that connection and kind of working with you guys.
All right, well, we're almost at time, so we're just going to sign off now. And thank you everybody for joining us today and spending your lunch with us. We appreciate you all.
Thank you.
Bye.
Have a great day, everybody.
Bye-bye.